I think everybody knows cholesterol is a product that's made by the liver, and not just of humans, but of chicken and geese and cows and pigs and turkeys. So we make cholesterol in our liver, and we use that cholesterol to make sex hormones like testosterone, estrogen, vitamin D, cortisol. It's used in creating the outer lining of cells called the membrane. But we also get cholesterol in our body from our choice of diet. And if we're eating animal foods, we get cholesterol. If we're eating apples and oranges and beans and peas and rice, we get no cholesterol, because you probably know an orange doesn't have a liver. Cholesterol is a good guy when it's at the sweet spot, when it's enough to support all those healthy productions. But we've learned since easily the 1950s and 60s that increased cholesterol in the blood, whether it's coming from the food, coming from the liver, coming from genetics, because it's heavily controlled by genetics. Your mom and your dad either give you a gift or they don't, but it shows up in your blood. That it's one of what's called a risk factor. And people confuse risk factors. A high cholesterol isn't a death sentence in everybody, but in some it is. In some it literally ages, strokes, heart attacks, leg circulation, kidney disease, and early death. And you have to be very specific with a patient. I have lots of patients with high blood cholesterol, and I check their arteries and they're shockingly young, and I don't need to be as aggressive or prescriptions. But naturally, there's a lot of people out there that one of the biggest reasons they've had the heart attack, the stroke, maybe guys, the erectile dysfunction, maybe died, is they had a high cholesterol. Maybe the diet they were eating was too animal food heavy, too processed food heavy, too added sugar included heavy obesity. Maybe they inherited the genetics. About 1 in 250 people inherit a gene that can drive their cholesterol sky high from birth. So by the time you're 25, 30, 35, you may already be suffering this disease we typically think of for the elderly. But I just literally emailed a 31-year-old patient to tell him he has plaque already in the arteries to the brain called the carotid arteries. We don't look very often in 30-year-olds. If you look, you'll find it. It's the American way, unfortunately.